Yes, so I really am pleased to introduce Dr. Faith Orchard. So Faith is a lecturer in clinical psychology at the University of Reading, and Faith's research focuses on anxiety and depression in young people, including a particular interest in sleep disturbance. So thanks so much, Faith.
Thanks, Emily. Nice introduction there. I'm going to talk a little bit more about the background to sleep and sleep problems. So covering what sleep is and how we sleep, how this changes during childhood and into adolescence, and then thinking a little bit about what sleep problems might look like for teenagers and how that might relate to mental health. And then Dimitri is going to nicely take on from there and talk about practical tips for how we might support these problems and these difficulties. So starting with the simple kind of background then to how we sleep. So there's two key processes involved in being asleep and being awake. And the first one of these is called sleep homeostasis. Now, this is the pressure that builds up throughout the day that makes us kind of ready for bed. And this gradually is building throughout, unless we nap, in which case it might kind of retract a little bit. But the idea being that by the time we get to bed, this drive for sleep is really quite high and ready to kind of force us into falling asleep. The other processes are kind of biological clock. Now, you probably heard a lot about circadian rhythms in the body, and they do work in lots of different cells and processes throughout kind of human functioning. And it's the same for sleep as well. So we have this circadian rhythm that helps to kind of keep us asleep and awake at the right times of day. So our body knows when it's morning and it's time to get up, and when it's bedtime and it's time to go to sleep. And it supports those processes by releasing the right hormones at the right times of day. So these two systems work together, and I've just included a figure, simple figure there on the slide of how this works. So you'll see there's the S line on top, which is the sleep homeostasis. So you'll see the line rises throughout the day as the pressure builds and then drops back off again during the night. And similar then for the C line, the circadian rhythm, you'll see this is kind of pulsing throughout, up and down as we're awake and then as we're moving towards bedtime. So these processes, in theory, work nicely together to keep us awake during the day, get us up in the morning and help us to go to bed in the evening. So throughout childhood, as I'm sure you'll be aware if you know young people or if you have children of your own, sleep changes quite drastically. So the main thing that we probably notice is the quantity of sleep. So from infancy through to adolescence, we see a decline in how much sleep young people need. And I've just put some guidelines there on the slide of the sort of the recommended amount of sleep that we think is needed for these different age groups. So we see, the preschool ages needing a lot more sleep there, kind of 10 to 13 hours, and this dropping off down into adolescence where it's recommended that they should be getting around 8 to 10 hours sleep. Now, it's always worth saying, and I will talk more about this, that there are massive individual differences for sleep. So some people will need less and some people will need more. These are just kind of ballpark figures. But for adolescents in particular, I think what's really key to note is that there's a lot of data suggesting that most teenagers don't get what is considered to be the recommended amount. So a lot of studies suggesting that about a third or less of a third of teenagers will actually get that recommended amount of sleep. Also, once we kind of move into childhood and through childhood and adolescent years, some young people will also experience sleep problems. And these are really varied. There are lots of different recognised sleep difficulties and sleep disorders. Some of the more common ones might be things like insomnia, so difficulty getting to sleep and staying asleep, or experiencing things like nightmares or night terrors. I'm going to talk about some of the more common ones a little bit later on, but there's a bit of an overview there of the variation, I guess, in what young people might experience. So focusing a little bit more then on adolescent sleep in particular. So the term the perfect storm was coined a number of years ago now to explain this experience of adolescent sleep and why it is so problematic. And this term refers to the fact that there are a number of different factors that kind of collide and interact to make sleep in teenagers particularly challenging. And I just would like to talk through a few of those with you. So the first factor is the biological side. And as many of you know, there's lots of biological changes that happen throughout youth and adolescents in particular, obviously going through puberty. But what also happens is some biological changes to sleep habits. Now, the most notable thing here is actually to that circadian rhythm that I mentioned at the start. So this biological clock. So in the teenage years, what happens is that biological clock shifts later and later. And the consequence of this means that most teenagers won't want to go to sleep or won't be able to go to sleep until much later in the evening than they would have done in earlier teenage years or earlier childhood. And this shift to kind of this later rhythm actually moves back again for adulthood. So we go back to earlier bedtimes once we move into adulthood. So it's quite a unique adolescent kind of experience that we see. And this kind of was reflected quite nicely in Kathy's introductory talk about co-space study, that we are seeing teenagers sort of experiencing this slightly later routine at the moment. Also, kind of in line with that falling asleep later, naturally, they also need to get up later. So the natural rhythm is to have a slightly later system than we might like them to have. The second factor then is the psychological side. And this refers really to the fact that during the teenage years, young people are exploring their independence a lot more. So they're relying a lot more on friendships. They might be in romantic relationships. They're possibly kind of, moving away from relying on their parents quite so much. And the reason this matters for sleep is that quite a lot of the socializing that occurs for teenagers happens in the evening. So whether that is face-to-face in kind of normal times, or whether it's on social media, which is probably happening even more at the moment, lots of young people are communicating in the evenings, whether that is, by phone or by chat, or on social media. The final factor then that causes a bit of a difficulty for teenagers and is influenced or altered, I suppose, a little bit at the moment. And this is more of the societal factors. And the big one here is actually school. And the reason for this is that, as I just mentioned, we have this biological clock, which is shifted to being later for teenagers. But that doesn't match nicely onto our school start times, which dictates teenagers need to get up relatively early in the morning. And the consequence of these two factors interacting is that the window for sleep ends up actually being quite small. So teenagers aren't able to fall asleep until later, but they're being kind of dragged up and off to school early in the morning. That obviously has been different for us during lockdown, and at the moment most young people won't be needing to get up for school, although that could change for some in the coming weeks. But kind of, I suppose, in normal times, these three factors are causing quite significant problems for teenagers, and will still be causing problems for some teenagers at the moment as well. So I suppose just then, the caveat then is what does this look like during COVID? And really nice to have some of that co-space data to reflect on. I mean, the most likely scenario I think that we are hearing from families that we talk to is that there's just lots of variation. So some young people are sticking to their kind of routines from before, where they're finding it able to do so. Others are actually allowing their body clocks to do kind of what they want. So actually letting their bodies go to sleep later and wake up later. But there might be other young people as well who are experiencing quite significant difficulties at the moment, and it might be that they are experiencing problems with getting to sleep or with getting up in the morning. But I think that the main thing that we're really expecting is there's going to be a lot of variation in how people are coping and responding at the current moment. So just thinking through then some of the more common adolescent sleep difficulties, I've just highlighted a few key ones here. So the first one, insomnia, which I've mentioned already, is this idea of finding it hard to get to sleep. And this might be falling asleep, or it might actually be waking in the night, or even waking up too early in the morning. But the whole kind of bigger picture there is about just not being able to get to sleep, even though you want to and you're trying. That's a really common problem for teenagers, typically. The flip side of that is the hypersomnia problem, which is sleeping too much. Now, out of kind of COVID times, this is a problem that we don't see as often because of all the factors I've already mentioned, though. So the fact that young people aren't tired until later, and then most young people are getting up and going to school. It's actually quite hard for teenagers to sleep too much. They just don't really have the option. That might not be the case, though, if teenagers are not at school or not able to attend school for whatever reason. And this also might be something that young people and families might be seeing more of at the moment, now that there is kind of the option for that to happen. The final area is, again, kind of links back to this circadian clock, and these are called the circadian rhythm disorders. And I've already mentioned that most teenagers find it hard to get to sleep until later. But another common problem that we see in teenagers is what's called delayed sleep phase disorder. And this is when that circadian rhythm is pushed even later back. So not kind of the same standard, slightly later bedtimes that most experience, but actually significantly later. And again, this might be something that people are experiencing at the moment. So the final area that I want to touch on before I hand over to Dimitri is thinking then about the relationship between sleep and mental health. Now, this is an area of research that is really kind of booming at the moment, and over perhaps the past 5 to 10 years has been gaining a lot of attention. And it's a really important area of work that I think can hopefully help us to support families better. So when we try to understand the relationship between sleep and mental health, there's research that's kind of come from 3 key areas. The first one is what we call cross-sectional research. Now, this is when we look at young people at one specific time point, and we might look at any sleep problems they're having and any mental health difficulties that they're having. And the research from that area suggests that there's a really high kind of co-occurrence of sleep and mental health problems. This is particularly common with things like anxiety and depression, but it also stretches across a wider range of mental health difficulties. So what we know is that young people who are experiencing anxiety or depression are really likely to have difficulty sleeping, commonly things like insomnia, but also vice versa. So young people who are experiencing insomnia are also quite likely to experience problems with their mood or their worries. So we've got good evidence that these things can kind of come up or occur at the same time. The next area of research is then what we call longitudinal research. And this is when we look at young people at multiple time points. So this is when we want to know whether one of these difficulties might come before one of the other difficulties. So people have looked at whether sleep problems might predict later difficulties with mental health and the vice versa. So whether mental health problems might predict later sleep problems. And there's relatively good evidence for both directions. So sleep can lead to mental health and vice versa. At the moment, there seems to be, particularly for anxiety and depression, slightly stronger evidence that sleep problems can lead to mental health difficulties. It's obviously not the case for everyone, but there's evidence that that can happen. Now, that might be slightly worrying for some of you who, are having sleep problems yourself, or have young people in your family who have sleep problems. But hopefully this final point is a bit more reassuring. And what's coming out really nicely at the moment in the treatment research is the fact that actually we're getting good effects where if we treat sleep problems, we're seeing good improvements for mental health as well. So actually, even some quite simple sleep techniques can really make a difference for the well-being of young people, parents, and family members. So hopefully that will lead quite nicely into the next talk that we have. So I'm going to pass back to Emily to do the introductions.